Welcome back all of you to Mock Test Explanation Series Part 18 for Government Nursing Officer exams. Let us go to the first question. What advice should a nurse give to a patient on lithium therapy? Let us have the options. First option, drink lot of water. Second, take medicines after a meal. Third option, take medicines on empty stomach. And the fourth option is take high calorie diet. Let us see the answer. The answer is drink lot of water. Let us go to the explanation session now. Drinking lot of water is very important for lithium therapy to prevent lithium toxicity. Lithium toxicity, you can see here, lithium toxicity is the main side effect of lithium therapy. So the nurse should advise to drink lot of water when patient is on lithium therapy to avoid lithium toxicity. The client should drink at least 6 to 8 large glasses of water each day to avoid lithium toxicity. Next question. Nurse advised to give edema for patient with chronic liver disease. What position is used to administer enema? Let us have the options. First option, prone position. Second, supine position. Third is Sims position. And fourth is Trendelenburg position. Please lock your answers. Let us go to the answer. The right answer is third option, Sims position. It is left lateral position. Let us go to the explanation session. Sims position. Patient lies on their left side with their right leg bent at the hip and knee. We can see the diagram here. The Sims position, left lateral position. Next question. Nurse notices redness and itching around intravenous cannula insertion site. What she should suspect? Redness and itching around IV site. First option, allergic to fluid. Second option, allergic to IV cannula. Third option, infiltration. Fourth option is phlebitis. Please lock your answers. The right answer is phlebitis. Inflammation of vein is phlebitis. Pain and redness with inflammation at the site of cannula are termed superficial thrombophlebitis. See the diagram here. In case of thrombophlebitis, stop the infusion and remove the cannula. That is the action to be taken in thrombophlebitis. We can see the diagram with the redness in the IV cannula site. Next question. All of the following are sesamoid bone except. The word except is the negative word. Options. First one, patella. Second option, fabella. Third option, calcaneum. And the fourth option is seamella. Please lock your answers. The right answer is third option, calcaneum. The calcaneus or heel bone is a short bone. All other are sesamoid bones. Sesamoid bones are small, round or oval-shaped bones embedded within tendons acting as pulleys to protect tendons. Examples are, see here, patella, then fabella. You can see the diagrams. Then third one is seamella. You can see the diagram here in the right side and the pisiform bones diagram in downside. So these all bones are sesamoid bones. Next question. How frequently will you conduct blood test initially while patient is on regular Clozapine? The frequency. Twice a week. Second option is weekly. Third option is monthly. And the fourth option is fortnight. Let us see the answer. The answer is weekly. Clozapine is an atypical antipsychotic medication for treatment of resistant schizophrenia. So this is antipsychotic, and clozapine can cause a serious blood condition called agranulocytosis. So this is the serious side effect of clozapine. The blood cells will be affected, agranulocytosis. So the blood investigation should be done. Monitoring frequency for blood test is initial phase, first 18 weeks, weekly we have to conduct blood investigations. Then after the initial 18 weeks, every fortnight blood investigations, and after 12 months, monthly monitoring of blood is required for clozapine intake to monitor the agranulocytosis. Let us go to the next question. Which of the following is the contraindication of gastric aspiration from nasogastric tube? Contraindication, this is a negative word, so you have to be careful. First one is hypertension, second option is diabetes, third option is esophageal varices, and the fourth option is severe dehydration. Let us go to the answer. The answer is option 3, esophageal varices. Contraindication of Riles tube or nasogastric tube insertion. First one is esophageal varices stricture, second one is recent esophageal banding, third one is coagulation abnormalities, fourth one is nasal or pharyngeal obstructions, fifth one is severe maxillofacial trauma, and sixth one is basal skull fractures, and seventh one is unstable cervical spine injuries, and eighth one is caustic or corrosive ingestions. Here you can see the options: hypertension, diabetes, esophageal varices, severe dehydration is given. So in these options, esophageal varices is the contraindication in the list given in the left side. So it is the right answer. Next question. Injection morphine is given intrathecal during procedure for pain relief. After procedure, which of the following analgesic you will not administer? You will not administer. That is a negative word. You have to be careful. First option is paracetamol. Second option is diclofenac. Third option is tramadol. And the fourth option is fentanyl. Let us go to the right answer. The right answer is fentanyl. Morphine is opioid analgesic, and fentanyl is also synthetic opioid drug. So the administration of fentanyl after morphine may cause opioid toxicity, and that can cause respiratory depression. That's why we cannot give these two opioids together to avoid morphine or opioid toxicity. Next question. Patient admitted with acute renal injury and nurse is advised to monitor strict urine output. She notices urine output is less than 100 ml for last 24 hours. It indicates less than 100 ml. It indicates first option urine output is less, second urine output is more, and the third option is it is normal, and the fourth option is none of the above options. Let us go to the answer. The right answer here is urine output is less. A healthy adult typically produces between 800 to 2000 milliliters or 0.8 to 2 liters of urine in 24 hours. Oliguria referred to urine output of less than 500 ml per day adults. So here it is oliguria. Anuria is a condition where there is no urine output. So here it is given 100 ml urine output in 24 hours. So it is less. So the first option is right, oliguria, or it is less. Next question. Patient with anorexia nervosa will have first one tachycardia, hypertension, hypothermia. Second one bradycardia, hypotension, hypothermia. Third one tachycardia, hypotension, hypothermia. And fourth one is bradycardia, hypertension and hyperthermia. Let us see the right answer. The right answer is second one, bradycardia, hypotension and hypothermia. Anorexia nervosa signs and symptoms: low weight, dry skin, brittle nails, muscle weakness, dizziness, fainting, bradycardia, hypotension. So the options are here. Hypothermia is also given here. So we can see the options given is bradycardia, hypotension, and hypothermia. So second option is the right answer. Hypertension, hyperthermia all are wrong answer. Next question. Following all are blood transfusion complications except 1. Trally, 2. Hemolytic reactions, 3. Transmission of infection. Fourth option is fluid deficit. Let us see the right answer. The right answer is fluid deficit. So this is a negative option. So fluid deficit is not happening with this one. Complication of blood transfusion, trally, transfusion related acute lung injury, hemolytic reactions, transfusion infections, and fluid volume excess. Fluid volume is excess. Here in the option, it is given fluid volume deficit. So this is the wrong option. That's why it is collected, because the negative word except is given in the option. So this option can be selected for the question. Next question. Patient is suffering from dyspnea. Which position will you provide for patient to relieve? In dyspnea, which position you can give? First one supine. Second one is prone position. Third one is Trendelenburg position. And the fourth one is Fowler's position. Let us see the answer. The right answer is for Fowler's position. Fowler's position, you can see in the figure, Fowler's position says standard patient position in which the patient is seated in semi-sitting position. This position helps in improved breathing and oxygenation by relaxing abdominal muscles and promoting lung expansion. We can see the muscles are relaxed and the lung expansion can be promoted. Next question. A surgeon is going to give a skin incision on a patient. Which of the following is to be done? The first option is sign in. Second one is sign out. Third option is time out. And the fourth option is time in. Let us see the right answer. The right answer is time out. WHO surgical safety checklist. Sign in occurs before anesthesia induction. Time out before the first incision. Sign out before the patient leaves the operating room. Tip is sign anesthesia, time incision, out of OT. So this is the memory tip to remember. Sign, time and out. So anesthesia, incision and out of operation theatre. Needle stick injury can result in all of the following except the negative word is there. Be careful about the options. Option 1 is HIV. Option 2 is HBV. Option 3 is HCV. And option D is malaria. Let us see the right answer. The right answer here is option for malaria. Bloodborne diseases that could be transmitted by a needle stick injury include the below. Human immunodeficiency virus HIV, hepatitis B, HBV, and hepatitis C, HCV. These all are the bloodborne diseases that can be transmitted by needle stick injury. Malaria is a vector-borne disease transmitted by the mosquitoes. So it is not added in the bloodborne diseases category. So it is the right answer. Next question. Calculate pulse pressure if the blood pressure is 115 by 70 mm of Hg. Let us have the options. Option 1 is 35 mm Hg. Option 2 45 mm Hg. Option 3 55 mm Hg. And option 4 is 40 mm Hg. Let us go to the answer. The right answer is option 2 45 mm Hg. Pulse pressure is the difference between systolic and diastolic blood pressure. So it is a difference. Pulse pressure equal to systolic BP minus diastolic BP. That is a formula for pulse pressure. Given BP is 115/70 mmHg. So 115 is the systolic and 70 mm is the diastolic BP. So here the pulse pressure is 115 minus 70, that is 45 mmHg. That is the right answer. Normal pulse pressure is 30 to 40. Below is narrow pulse pressure, below 25, and above 40 is widened pulse pressure. You can see the diagram. Next question. A primary gravida with O negative blood group delivered a baby with O positive blood group. While DCT was negative, what should be done next? First option, repeat DCT. Second option, give 300 micrograms of anti-D to mother. Third, give 150 milligram of anti-D to mother. And for no need to give anti-D to mother. The right answer here is option 2, give 300 micrograms of anti-D to mother. RH incompatibility occurs when a pregnant woman is RH negative, doesn't have the RHD antigen, and her baby is RH positive as the RHD antigen, leading to the mother's immune system creating antibodies that could harm the baby red blood cells. Anti-D injection is given to prevent this. Standard dose is 300 micrograms. We can see the diagram here. It is anti-D liquid injection 300 microgram per 1 ml. So 300 mcg anti-D is the right answer here. Next question. A patient has tried to commit suicide with a drug overdose. Which of the situation depicts that the patient has a high risk of suicide? The first option is wrote a note. Second option, informed a relative. Third option, impulsive attempt. And the fourth option is alcohol intake before committing suicide. Here the right answer is option 4, alcohol intake before committing suicide. Alcohol and suicide have a tragically close relationship. Individuals with suicidal thoughts often turn to alcohol, and alcohol increases suicidal thoughts. Risk of suicide and alcohol. Alcohol increases suicide thought. Alcohol can increase impulsive behaviors. Alcohol can affect decision making and logical thinking. So all these problems are posed by alcohol. So it will increase the risk of suicide. So it is the right answer. Alcohol will increase the suicide risk. Next question. Patient is allergic to beta-lactamase, and which of the following drug is safe to administer? First option is amoxicillin. Second option is penicillin. Third option is vancomycin, and fourth option is cefazolin. Safe to administer. So which is not beta-lactam? That is the question. The right answer is vancomycin. Beta-lactam antibiotics are broad class of antibiotic characterized by a beta-lactam ring in their chemical structure. You can see the ring here in the figure. So beta-lactam antibiotics include penicillins, amoxicillin, ampicillin, piperacillin, etc. These are all penicillins. Then cephalosporin, cefazolin, cefalexin, cefuroxime, ceftriaxone, and septazidime. These all are the cephalosporin antibiotic, beta-lactam antibiotic. Then carbapenems. These are imipenem, meropenem, and doripenem. These all are carbapenem category of beta-lactam antibiotic. And the other category is monobactams. That is astronum, then tigamonum, and taptoxin. These all are the monobactams. So these all are beta-lactam antibiotics. Vancomycin is a glycopeptide antibiotic. That is not a beta-lactam antibiotic. So that can be safely given with a beta-lactam allergy patient. Next question. The patient admitted to ward had 3 episodes of vomiting. Which of the following drugs should not be given? Negative. Should not be given in vomiting. Let us have the options. First one is metoclopramide. Second one is promethazine. Third one is tramadol. And the fourth option is ondansetron. Let us have the answer. The answer is third option, tramadol. Here, common adverse effect of tramadol is nausea, vomiting, dizziness, etc. So, we cannot take. Here in the options, Metoclopramide, you can see metoclopramide is a medicine for nausea, vomiting, GERD, etc. So it can be given in nausea. Promethazine is also for nausea, vomiting, vertigo. It also can be given. Tramadol is an analgesic and it induces vomiting. So it cannot be given in vomiting. And ondansetron is actually an antiemetic. It should be given during the vomiting or nausea. So here tramadol is the right answer, which will induce vomiting, cannot be given. Next question. Patient come to ED with uncontrolled diabetes. Urine test showed ketone positive. ABG report showed pH 6.25, PCO2 39, bicarb 18 and blood glucose is 600 mg per dl. Which of the following condition is present? Here you can read the values and assess which is the condition. First option, respiratory acidosis. Second option is respiratory alkalosis. Third option is metabolic acidosis and fourth option is metabolic alkalosis. Please select your right answer. The right answer here is metabolic acidosis. Let us go to the explanation. Blood pH normal range is 7.35 to 7.45. Value below is acidosis and above is alkalosis. So that is about the blood pH. Then bicarb 22 to 28 is the normal range. It is indicating metabolic. Below is acidosis and above is alkalosis. Then PCO2, it is indicating respiratory. It is the normal value 35 to 45. Below is alkalosis and above is acidosis. Then here the pH is low in the question, 6.25. That is acidosis. It is pH is indicating acidosis. PCO2 is low. It is indicating towards alkalosis. So it is not the right answer. So it is not of respiratory origin because the pH is indicating acidosis. Then bicarb is low, indicating acidosis. So bicarb and pH is indicating acidosis. So bicarb is metabolic. So this is indicating metabolic acidosis. So the right answer here is metabolic acidosis. This way you have to analyze the values and find the final diagnosis. Next question. Social skill training for schizophrenia patient is done for which symptoms? 1. Positive sign. 2. Negative sign. 3. Hallucination. And 4th is delusion. Let us see the right answer. The right answer is negative signs. Here you can see the positive and negative signs. Schizophrenia have positive and negative symptoms or signs. Positive symptoms are hallucinations, delusions, etc. Then the negatives are social withdrawal, flattened affect, lack of motivation and decreased speech. So the options given are positive signs only. Social skill training for schizophrenia patient is done primarily to address negative symptoms of the disorder. It is mainly done for the negative. So positive symptoms are treated with antipsychotics, cognitive behavior therapy, CBT, etc. So here the right answer is negative symptoms. All other options are positive, which is wrong. Next question. An antenatal mother come to OPD with hemoglobin of 8.5 gram percentage. Which of the following is true? First option is mild anemia. Second option is moderate anemia. Third option is severe anemia. And the last option is no anemia. HB 8.5. The right answer is moderate anemia. Let us have the table. Anemia in pregnancy. During pregnancy, anemia is classified as 3 categories. Mild anemia, hemoglobin is 10 to 10.9 gram per dl. You have to remember the range. Then for the moderate anemia, hemoglobin is 7 to 8.9 gram per dl. 7 to 8.9. So that was the right answer here. Severe anemia, hemoglobin is less than 7 gram per dl. So in this question, the category is moderate anemia, 7 to 8.9 gram per dl. Next question. Following are the use of central line catheter except the negative. So which is not the use? You have to be careful. The options are CVP monitor. Second is administer medication. Third is left ventricular function. And the fourth option is TPN administration. The right answer here is option 3, left ventricular function. Central venous catheter, you can see the diagram. It is used to monitor CVP, is all of the use, administer medications, administer blood and blood product, administer total parenteral nutrition TPN, collecting blood samples, etc. So these all are the functions. Here the option given is CVP monitor is there, administer medication is there, left ventricular function is not there in this list, and TPN administration is also a function of CVP or central venous catheter. So the right answer is left ventricular function, which is not a function. Patient has undergone donor nephrectomy. Which of the below drug will not be given? Will not be given. Lot of negative word questions. Be careful. Morphine is the first option. Second option is fentanyl. Third option is paracetamol. And the fourth option is diclofenac. Among this, which is not given? The right answer is option 4. Diclofenac should not be given during donor nephrectomy, because diclofenac is a non-steroidal anti-inflammatory drug. It can have anti-platelet effect. So it can interfere with platelet function and potentially increase the risk of bleeding. It can increase the risk of bleeding. That's why after nephrectomy or during nephrectomy, you cannot give the anti-platelet drug like diclofenac. Next question. Signs of acute blood losses are: option 1, tachycardia and hypertension. Option 2, bradycardia and hypertension. Option 3, tachycardia and hypotension. Option 4, bradycardia and hypotension. The right answer here is option 3, tachycardia and hypotension. Acute blood loss signs and symptoms include tachycardia, hypotension, cold clammy skin, pallor, weakness and fatigue, rapid shallow breathing, decreasing alertness, and decreased urine output. Here you can see the tachycardia and hypotension is mentioned in this option. So tachycardia and hypotension is there. Brady is not the option. Then hypertension is also not an option. So only this option is the most appropriate option, tachycardia and hypotension. Last question this is: in an immunocompromised patient, the nurse should take infection prevention methods when WBC count is option 1, 11,000, option 2, 5,800, option 3, 7,000, and option 4 is 2,000. Let us see the right answer. The right answer here is option 4, 2,000. The explanation you can see here: normal WBC count in adult is 4,500 to 11,000 WBC per microliter. Here the chart you can find neutrophil count, absolute neutrophil count ALC, and risk of infection is mentioned. The highlighted box you can see 2 neutrophil count and absolute neutrophil count 1, that is 2,000 or 1,000. Moderate or increased risk of infection. So here, in an immunocompromised patient, a nurse should implement infection prevention method when the white blood cell counts is below 2,000 or the absolute is neutrophil count or ANC is below 1,000. So this is the right answer. Below 2,000 of WBC or